today I'm super excited to have David here. I think, David, we've never actually met in person. I just realized, I think, and that's the same for a few of you actually. Like, I've never met you in person. Then you popped up in those daily salons, and I was kind of totally surprised by how many incredible contributors we already had. And you were one of them at the beginning. I was like, who is this person? And then, like the name popped up over and over again. I think even in the Robin Hanson salon, Deliberate Exposure, like there were some really good conversations and discussions that you kind of championed in the Q&A. And so I did a little bit of research. Then first, I think, came across a few papers that you wrote on, I think it was cryptocurrency and terrorism by cryptocurrencies. And now I'm super glad to actually have you here on the super timely topic on how to accelerate vaccine production now. I think even after the talk, I would love to get back in touch with you, because there's a few folks that I think are working along similar lines that I'd love to connect you with. I'm not sure if they're all coming today, but if they're not here, then I'd love to put you in touch. But for now, I will share your bio, your longer bio in the show notes here. I think officially you're a postdoctoral researcher at the University of Haifa's Health and Risk Communication Research Center. And for that, you've really kind of research across the board, but really mainly on mitigating global catastrophic biological risks. And that also kind of in several groups at Oxford. So I think this is a very timely time to be thinking about this, the topic that is definitely very close to Foresight's heart in terms of nano, bio, and AI risks. And yeah, so I'm really glad to have you here, and I'm hoping that we have some action item flowing out from this directly. So thank you so much. Thank you everyone who joined so early, or / for some of you in the afternoon on a Sunday. And yeah, I'm excited for the talk, and I'll share more about the talk's topic and your bio in the chat notes now. And I would say for everyone who's currently here as a participant, the way that we usually do it is that I take questions in the chat, and then I'll, after the quick introduction, we'll kind of cue them. And after David's introduction, I'll then take you one by one. Okay, sounds good? Alrighty, well, then the stage is yours. I can't wait.
Okay, so my background, kind of to give just a little bit more, is in public policy, which is what I got my PhD in. And the first key question that you ask when you're looking at a policy question is what's the question that you want to answer? What are you trying to figure out? And then the next thing is, okay, so now that you know what it is that you're trying to address, you figure out what solutions there are, which ones you want to look at, you evaluate them. And then there's kind of the second half, which is often more critical, which is how do we get there? How do we get from, we have this idea, something needs to happen, we have a solution, how do we make that happen? And most of the time, government doesn't actually do the thing that you want to have happen, even if they're integral in making it happen. And so the question is, how do you actually implement things? How do you get them done? And there's a huge list of ways that governments can do this. So the current discussion about the pandemic is raising lots of questions about that first half. Should we wear masks? How long should we keep the economy shut down? What do we want to do to cushion the impact on businesses and people? And all of those are really important questions. But then the thing that happened after that we're seeing is often trickier and harder to manage is how do we do it? How do we actually get the masks if we've decided that we need them? What legal powers exist to actually make businesses shut down? Can you actually get them to do it? So looking a little bit further ahead, some of the key things that everybody knows are going to be really important are things like being able to expand testing and produce vaccines. And we need to be able to do that. And the question is, how do you manage implementation for that? And the brief answer is government should not be in charge of actually doing that. Government is not going to be good at actually making vaccines, but they need to figure out how to de-risk it for companies, because right now companies are all kind of on the sidelines trying to figure out exactly how much they can risk in scaling up their production. And the kind of obvious piece that government can do that companies can't is take away risk. Specifically, government has very deep pockets. They can compensate people when they take risks that they perhaps ill-advised or just ones that didn't work out as well as they could. Right now we have a couple dozen candidate vaccines, and we're going to need to start making on the order of 7 billion doses if we want to vaccinate everyone. Lower, depending on how far the virus is actually spread by then. So we're really interested in trying to figure out how we can make sure that we make tons of these vaccines, but any one vaccine is not actually a great investment because most vaccines fail when they go through trials. And companies are going to wait until they're pretty sure that the vaccine is going to be commercially viable before they start producing it, which is directly at odds with actually having enough of them quickly enough. So the proposal, very simply, is for government to buy to sell options to producers for the things that they're making. So initially, I talked about doing this for vaccine production facilities. It seems the Gates Foundation decided that they were going to build a bunch of those. But even once you have the facilities, there's the vaccines that you're making. And the question is, does it make sense to make, 1 billion doses of vaccine if you're not sure that you're going to be able to sell them, if you're not even sure it's going to be approved? And the answer from a business perspective is obviously not. And from a public policy perspective, the answer is obviously yes. And the answer to this is for the government, what I'm proposing is the government should order these now, guarantee payment, and if they don't work out, then the government shoulders the loss. And if they do, it's perfectly fine for private companies to capture the gains. This is going to be a subsidy to large businesses. People don't necessarily like those, but I think that the straightforward argument that we desperately need to make sure that this happens is convincing enough to say that we should be doing this. So that's the idea. I'd love to hear people's ideas about what it is that they think about this and what it is that they are interested in hearing more about.
You're free to unmute yourself if anyone has a question or wants to kind of like poke David in a particular direction now.
I'll step up. This is David Grossoff. I'll start the video. Several years ago, there was an understanding that there was a market failure in the production of vaccines, and there was a proposal among economists concerning essentially a bounty system. If you produce a vaccine, if you develop a vaccine in R&D to a requisite level of specifications, you get a big bonus pile of money, and the rights to produce it, which were largely uneconomic, for example, for tropical diseases. Sorry, I haven't had enough coffee yet this morning. The bounty would help resolve the market failure, and the rights for producing and distributing would go into the NGO sector, I think was the basic idea. There were also subsidized programs from what at that point was a backwater area and the sort of pharma. It was a side business. It was a less risk, a low beta side business that wasn't that profitable, I think, for Sanofi. And so the economics of vaccine production have been awkward.
Those were the standard vaccines. The standard vaccines were the low risk side business.
Happy. I was deep in this because I had I was working with I co-founded a startup that had a better drug vaccine delivery system. Those like scratch and patch that are now in discussion where you put it into the skin. So I was hip deep in this, and everyone was saying, great idea. If the Gates Foundation or some other market failure resolving institution doesn't want to deal with it, goodbye. And it was a very uneconomic area. And so I was looking around at economists' ideas like that, and it seemed like the one with the bounty idea, where the responsibility for production would shift out of the private sector, was as viable as any other idea. And I'm wondering whether anything's changed concerning that.
Okay. So a couple of things. First, yeah, the vaccine business is a low margin, very complex line of business. The issue that keeps on popping up fairly routinely for the past, from what I recall, 20 years or so, is that companies don't really want to build billion-dollar manufacturing plants to make something that's going to make them a couple % a year, especially because that's not the kind of business that they're in. And that makes sense. We don't want vaccine prices to shoot up because vaccines are critical for global public health, and most of where standard vaccines are going is poorer countries that can't actually afford to pay the amount that these companies would like to charge. Yeah, certainly for tropical diseases, we have this issue. So there are a lot of kind of market failures. Market failures is a kind of specific concept about what's happening. I don't know that it's really a market failure when there's a vaccine that has little demand and is very expensive to develop, doesn't get developed. In some ways, that's a market success. We just don't want that to happen because we'd like to treat this anyway. So what we're kind of thinking about is, okay, so how do we subsidize this to change the picture? It would be great if internationally there was a decision made that we really wanted to subsidize this. I think that that there are good arguments to be made that global health is really important and is worth the comparatively tiny amount of money that we would need to pour into it. The current discussion is really different in that there's actually a tremendous amount of willingness to pour billions of dollars into this, thankfully, for obvious reasons. And the question is just, how do you actually make it happen? One of the benefits from doing something like subsidizing vaccine production or facilities is that building up a ton of productive capacity that doesn't get used means that there's all of this productive capacity sitting there for somebody to use later. And then just the last point that I wanted to address is, you said it might make sense to hand over vaccine production to NGOs or governments. Maybe. I'm really skeptical of the idea that we want to hand over what is essentially a very complex business process, which is not just the kind of pharma piece of actually making it, but also the question of how you source everything, how you do it cheaply, how you do it well. All of those things are kind of tricky, and they're exactly what pharmaceutical companies that deal with this are really good at already.
U.S. Army is also really good.
What?
Historically, the U.S. Army has also been awesome. I think they helped develop antibiotics in World War II in time to save a lot of lives in the Pacific Theater.
Yeah.
And like, don't buy.
No, that's true. The U.S. Army is in a very different position than it was 70 years ago now, in that a huge amount of the expertise that they have for doing development has been offloaded onto contractors, the same types of companies that we would kind of directly want to have doing some of these things. I'm not, the question of whether we should greatly expand the role and capability of government is a question that is discussed. I don't think that that's where we are right now. I think the question right now is, how do we do this really quickly? And can we put incentives in place so that these companies are willing to dump the, $500 million or $1 billion into just ramping up production?
Okay, I'll let others.
All right. Okay, great. We have Creon up next, and then Tom Khalil.
All right. Hey, David. Very interesting stuff, and I certainly find it to make sense to me. However, I'd like your thoughts perhaps on a sort of twin problem, or sort of there's another angle on this, which I think reveals another problem if we maybe go too far in certain directions. And at first I have to explain, I'm not an anti-vax person. I get my vaccinations. I even get my flu shots every year, even though they're not very effective in terms of how much they benefit the population, both who get them and who don't. You know, my friends are working on vaccines and all this stuff. Nevertheless, as you pointed out, it's very hard for them to be effective. And that coronavirus is probably going to be, you know, some people speculate like flu virus, where it mutates and comes back each year, which means it can be very difficult to kind of be playing whack-a-mole with something like that, with the timeframes involved in vaccine development and deployment. All right, having said all that, when you start talking about vaccinating 7 billion people, you're talking about a gigantic blockbuster drug from the point of view of whichever company produces it, and if it's mandated nationwide or worldwide, okay? And what is a long-winded way of getting to my question, which is what really worries me is sort of corruption and regulatory capture. What I mean is that all these companies who are desperate for the next blockbuster drug, and it's very expensive to develop them, and these companies, you know, arguably a lot of these pharma companies have not necessarily been, well, we look at it this way. We know why they're in this business. They're not in the business to save lives, okay? They're in the business for profit. And there's this game that gets played with the government and the pharma companies over safety and efficacy and cost and all these problems, right? Now, why is this going to be different with a vaccine? What is going to prevent some sort of malaligned incentives or even regulatory capture from ending up deploying a vaccine nationwide or worldwide that's mandated for everyone to take, that, you know, at best might be ineffective and at worst might be downright problematic? And there's even another problem that goes along with that, which is that once you have some sort of undue influence or regulatory capture where one company gets its mandated, that could mean that 20 others get suppressed or at least not selected, which might be much more effective. But it's like, I'm worried that the most effective one isn't going to get selected. It's the guys who know the guys who write the laws. Theirs is going to get selected.
Okay, so yeah, there are a lot of important points there. The first thing that I'd like to say about it is just the kind of straightforward case that, so granting lots of points about regulatory capture, and it's really important, and it's a huge mess. Right now, I'm much less concerned about regulatory capture than I am failure to scale up in time to save, you know, millions and millions of lives. Which is not to say that regulatory capture is not an issue, but how you arrange chairs might be important, but the Titanic is sinking. So I definitely think that it's worth thinking about. So that's the first piece. The second piece is you mentioned that COVID may become seasonal because of the mutation rate. The virologists I talk to say that while that's possible, it seems pretty unlikely. And this is all really high uncertainty because they haven't seen it. There's a lot of work about how it's been mutating a lot. Viruses mutate. That doesn't mean that the surface proteins that a vaccine would target or that your immune system target.
Let me just interject one thing right there. That may be, everything you said may be true. The common cold, or a lot of them are coronaviruses, from what I understand. We do not have a vaccine against them, even though that would be a gigantic blockbuster drug, and people have worked on it. And as I've said before, although this is less relevant, perhaps virologically, the AIDS vaccine has been 35 years in the making by Tony Fauci and crowd, amongst others, and it has never come to pass. We've never gotten a vaccine against AIDS. So everybody who thinks that we're just going to stay at home and wait 12 to 18 months might be disappointed. It's been 35 years and we've gotten no vaccine against that other major pandemic virus, which everyone was concerned about when I was younger.
So cold viruses, some colds are coronaviruses. One of the issues that we have with the common cold is that it's not one thing, it's like 20 different varieties. So even if you could create a vaccine for one of them, it wouldn't do very much to stop people from getting colds. It would shift the burden of cold to, you know, the 19 that are remaining. So yeah, so yes, they are coronaviruses. They're somewhat different. The issue with AIDS is really interesting. There are some really interesting discussions about exactly what it is that's happening. But to kind of, I think the easiest way to understand this is the human body does almost all of the work of fighting off viruses. That it does that whether it's smallpox or AIDS or coronavirus. The problem is that the human body doesn't actually fight off AIDS. To make an effective vaccine, you would need something that the human body can fight off. We don't actually have that. The way that AIDS works, we haven't figured out how to do that fundamentally. So there's a really good reason that AIDS vaccines are really hard. There's much less reason why coronavirus vaccines are fundamentally hard. The common cold is hard, but not because any one of the coronaviruses or other viruses that cause it are particularly impossible to make vaccines against. You pointed out that that vaccinations have risks. That's absolutely true. I would be one of the things that I think people don't pay enough attention to when talking about vaccine risks is the fact that there's no such thing as a perfect intervention in any case. Yeah, vaccines have risks, and seatbelts can do things like cut off your circulation when you get in a crash. But on net, they save tons and tons of lives. The reason that that's true is because the vaccinations that we actually use have been through tremendous amounts of QA, and most vaccines fail that QA process. COVID, the cost-benefit calculation is different, which means that it makes sense to take on more risk than it would otherwise, perhaps even not go through all of the year or more waiting period after you give people vaccines to see whether they're damaging. And that means that there are risks there. It's a really difficult situation. It's especially difficult because if, we hope this doesn't happen, but if there's a COVID vaccine that does end up having significant side effects, it would not only have those direct side effects, but also do a tremendous amount to undermine the progress in things like eliminating other transmissible diseases because people are going to be worried about vaccines once again. So there are some real issues with all of that. The last thing I'm going to say on all of this is you said regulatory capture is a huge issue. Absolutely. The reason that I think one of the reasons that I think that specifically options as a way to pay for the risk is a better way to deal with this than most of the other options is because it's a one-time intervention where we give this option to producers. It's not specific to one producer. If 20 companies want to sign up to do this, then they can. It's not something that requires a new bureaucracy to spin up, which is, I think, critical in this case because it will be slow. Okay, I think that we had another question lined up.
Yeah, you have Tom Khalil is up next. Just to Creon's point really quickly, were you in Andre Watson's talk on synthetic coronavirus vaccines and peptide therapeutics, where he showcased Ligandal's way of potentially being able to get a vaccine up very quickly, and then he was kind of like a little bit, at least on the side, talking about like or let's say a suspicion that he has for how his drug is currently being suppressed. And I can share the video in here in case that's relevant for people and they want to check it out. Were you in that talk at all or not, David?
Oh no, I was not. Sorry.
Okay, that may be an interesting for you. May be interesting.
It's worth watching the video.
Okay.
Yeah, it's not very long. It's
okay.
50 minutes.
Just a one-sentence answer to David Grossoff's question about government contracting for readiness resources. They do. There's a national stockpile. It's underfunded. We screwed that up. People in health security have been screaming about it for 5 years or so. Yeah, it's absolutely doable. We were doing it. Okay.
Okay.
Sorry.
All right, great. Tom is up next.
We can't hear you, even though you're not muted. I'm confused. Okay.
Can you hear me now?
Yes, I can hear you now.
Okay. So a couple comments and a question. One is to the question about organizations being winners and losers. So I agree with you if that process is politicized. There are some organizations that we've managed to sort of insulate from direct politics for the most part. So, for example, during the Ebola outbreak, I was able to get DARPA some additional money for them to rapidly go from bug to drug by identifying people who've been exposed to a pathogen, identifying the strongest antibodies, the neutralizing antibodies, and then creating a synthetic oligonucleotide construct to directly encode. And I have a link to an article that shows that a lot of the things people are most excited about, like these nucleic acid-based vaccines, were funded by DARPA, Inovio, a bunch of the different companies who are taking a very, at the time in 2014, were viewed as really long shots. So when you say the government picking in winners and losers, I think it's worth saying, how is that decision-making process made?
Yeah.
So in this, it was made by Dan Wattendorf, who was the DARPA program manager. He was isolating political decisions, and he could say, I want to be able to go from bug to drug in months rather than years, and was given the budget and the flexibility to say, I'm going to fund James Crow at Vanderbilt, I'm going to fund Moderna, I'm going to fund Inovio, I'm going to fund a portfolio of approaches, and my hope is that some of them will work. And so over the years, if you look at DARPA's track record, a lot of crazy things, but they also funded the internet and stealth technology and handheld GPS receivers. So as a taxpayer, I feel it's a pretty good investment. So I think you have to unpack the question of when you say the government picking in winners and losers, to say, how is that process being made? And I think that we do have a track record of organizations that can recruit competent people like the Federal Reserve, like DARPA, like parts of Treasury, that do a good job in the same way that over time, the Office of the Chief Scientist at Israel has done a pretty good job in terms of impacting biotech. That's number one. Number two, I'm interested in how your idea is the same or different from Michael Kramer's proposal for advanced market commitments. So colleagues wrote a paper in 2005 called Making Markets for Vaccines that led 5 countries in the Gates Foundation saying that they were prepared to fund the development of X million doses of a pneumococcal vaccine. So there were 2 elements for that. One, there was a price that the governments would pay, number one. And number 2, there was a performance-based specification called a target product profile, which said, we want a vaccine which is safe and effective for pneumococcal diseases, and here's what that means. And that intervention, that one intervention, eliminated the 15 to 20-year gap that usually occurs between when a vaccine is available in rich countries and when it's available in low and middle income countries. So that was effective. And the governments were also able to what the disability adjustment, if you're say per dollar, would be for prevention, and able to convince themselves that would be a good public health investment. So but it's the same basic idea, which is government is saying we will bear the demand risk if you bear the risk.
I think they are different, but I can explain a little bit more.
Great.
So two things. You had two questions. The first one is on government agencies being different and being possible to insulate them from politicization. Absolutely. I guess full disclosure, I've worked on things that DARPA funded before, but I have tremendous respect for basically everything that happens inside of DoD's decision-making process for their planning and their investments. There are specific things that are screwed up about it, but they're not related to politicization in the way that we think about it for other government agencies. So I definitely think that there's something there. I could talk for another couple hours if anybody was interested on all of the things that are problematic with the way that DARPA and DoD funds things. But they're different things, and they're much less problematic than the way that U.S. government in general does this. So yeah, I think that that's true. I think that there are lots of agencies. The Federal Reserve is absolutely at the top of my list of, hey, this is how you set something up so that it's really insulated from political pressure, because it's about as insulated as you can make something that's that central to monetary policy. Like it's kind of amazing that they've been as successful as they have been at preserving independence. I think CDC is actually a pretty good example of buffering from political requirements, partially just because it's far away. Being based in Atlanta means that the people there aren't being bugged by feds. Really ambitious political types tend not to want to go to CDC because they're not located near the places that they'd be able to do the types of things they want to do. I was at RAND for grad school. One of the things that RAND talks about being based in Santa Monica is they're far away. So they're a little bit insulated from kind of the inside the Beltway everything, which has some real advantages. So I think that yes, there are some huge advantages, and yes, there are places where you can really insulate things from politicization. And I don't think that can happen right now with COVID. I think that everything is much too high pressure. I don't think that it's feasible for COVID specifically. Not to say that it's not possible for vaccine funding generally. Just like right now, I think that that's not particularly likely to happen. Okay, how is this different from advanced commitments? So one of the big differences that it has is I don't actually think that the government should be making advanced commitments to buy something that's successful, because the way that has worked in the past is that federal governments or national governments around the world make commitments, take delivery, and are in charge of the distribution. The federal government right now has lots of problems with being in charge of distribution of anything. It also would mean that only the federal government can fund something like this. If Gates Foundation wanted to put up this type of put option so that they pay for things if the vaccine company or whoever realizes that it's not going to work out, there would be no problems with them doing so, because what happens if they're successful is not that it's delivered to the government at the pre-decided price, but rather the company is just allowed to sell it on the market the way that they would anything else, with all of the same, presumably, public pressure about not doing price gouging. And I think that while that's not always effective, I think that, again, the current situation is one where the companies will be under tremendous pressure to charge something that makes it available widely. So I don't think that advanced commitments are as effective for this specific case where we're trying to get lots of groups to produce things. The other part of that is you can use the option strategy to tell 12 different companies to start producing stuff. And if they overproduce and they decide that they don't want it, it's not, you're not in the same situation where the US government has said, oh, well, we have to take delivery of way more than we need, but rather, okay, great, so the company has more than they need to sell to the US and they can sell it internationally, and that's not a problem at all. So I think that there are some advantages to the option strategy where you give them the option to sell it if they decide that they don't want it or it doesn't work out. So I think that that's kind of the key difference. It is a somewhat technical difference. I would not say that advanced commitments would be a bad strategy. Just this one's a little bit different. I think you're trying to comment and I can't hear you again.
Oh, I was just saying, are you going to write something up on this explaining the difference between the
Yeah, I've been thinking about this. I was originally planning to write this as an op-ed or similar for how it is the federal government should be paying for vaccine production facilities. And then the Gates Foundation, I think a couple of days after I emailed Allison saying, I have this idea, we should definitely do something on this. The Gates Foundation said, so we're gonna build 7 factories. And we know that it's going to waste tons of money, but like it's a great investment anyway. And I was like, yes, that is fantastic. And also it means that my initial proposal to have the federal government use this option strategy isn't as necessary, at least, maybe not necessary at all. So I think that that's the key reason that I hadn't done it so far. And also, yeah, so yes, this is different. And I am planning to write up more how it differs. There are a couple of other people who also have written something somewhat related. I'm trying to remember who it was. There's a group, so I'm just, Alex Stapp and somebody else wrote something recently for Mercatus about how they think that it should be managed, that it involves more focus on getting rid of, and Caleb Watney, getting rid of regulatory burdens, which I think is all completely correct. We need to figure out how to, they were focused more on ventilators and PPE. And I think that they're right about kind of the barriers there, but they also talked about this. So there are a couple of other proposals, and I think all of them are worth consideration. And on some level, I just wish the federal government was stepping up in any way to deal with this using any of these strategies. Okay. Oh, and just to throw in, Derek Foster had asked, does this apply to COVID tests? And the answer is yes. Yeah, I think that the same logic applies.
And I just, from the chat, Gates is now backing away from the commitment. In what way?
That's disappointing. Okay, I mean, I think that it's incredibly important for something to happen to make sure that these factories get built ASAP. And I'm very concerned that nobody's broken ground on building them weeks ago when we knew that they were needed. And at this rate, they won't break ground on them for weeks. And these are very complicated buildings to make, and it's going to take months and months to make them. Yeah, okay.
Okay, and then there's a pledging conference organized by the EU, likely to happen soon, Tom? Is there already a website or something?
Not yet.
Okay, great. Thank you. Okay, then let's monitor that space. And then next one up, we have Mike.
Mike?
Mike, you're welcome to unmute yourself now.
Oh, hi. Yeah, you just touched on one question briefly, which was, has anyone looked at the cost breakdown? Why is it so expensive to bring these vaccines to market to begin with and taking longer?
I can talk about that.
And also, I was wondering if you looked at prediction markets that's similar to the options strategy that you're suggesting for a crowdfunding approach.
Yeah. Okay. So on, I'll do that in reverse order. Prediction markets are really useful for figuring out where the money should go. If we have strong indication that one vaccine or another is going to be more likely to pan out, then it's useful to aggregate that information in some way to figure that out. But that doesn't actually provide the money. There are mechanisms that Robin's talked about for years about how to use prediction markets to fund things. Perhaps if they had been launched a decade ago, there would be infrastructure in place to use that. He's plenty frustrated that nobody's been doing it. I think there are reasons why, but it's not an option right now. So that's kind of the short-term answer. The second thing is, why is it so expensive? So essentially what you're doing when you make a vaccine is building a giant biosecurity laboratory where you're playing with a virus that you know is dangerous because you want to vaccinate against it. So you build this giant facility, you have to deal with the HVAC engineering and the pressure requirements and the all of the things in terms of building the physical environment. You have to hook up all of the very expensive and specific lab equipment that you need to actually do it. And then you have to grow. Usually the kind of typical process for this is you're growing the virus either in chicken eggs or some other growth medium. And that takes a bunch of time and investment, and you're paying lots of very expensive to hire people, a lot of money to monitor that process and make sure that it's going well. The success rate for pharma production is relatively low, meaning you start out with 100 units of the thing that you're trying to make, and each step has a 90% success rate, but you have 10 steps, and suddenly you're looking at a really low yield. So a lot of the things involved are just really complicated and expensive to do. There are some new proposed methods for doing this that would be cheaper and more effective. People are getting ready to dump money into them right now because of COVID. I think that's a good thing. But in the meantime, it's really expensive because a lot of the things that you're doing are actually really complex and require large capital outlays.
All right, I just shared the meticulous COVID vaccine predictions, and we're actually going to have Anthony for a salon on Tuesday to talk about meticulous COVID-19 prediction efforts. And they're not incentive markets yet, unfortunately, of course, but I think still in terms of directing funding to the right opportunities, that may be a really good one. So if you're interested in that, please join on Tuesday. We had David Grossoff, you just commented. Do you want to say it out loud?
No, not really. It's a pretty simple.
Yeah. That's right. I mean, I could talk to any of the people I know in biosecurity, but building a BSL-3 or BSL-4 lab is just incredibly expensive, and you're basically making a really big one. So yeah, that's kind of a partial list of some of the things that you need. And the QA process is really, really critical. And one of the reasons that I think that it's critical that a pharma company run this, because they're used to doing it, and it's really, it's very difficult to do QA and quality control well for this type of process if you don't already know what you're doing. And a lot of the people proposing to be able to fix the problem really quick with their new idea have never actually done production at scale for anything like this.
Actually, I will jump in and say, Allison, there were people associated with Chiron before it was acquired in the Bay Area who were very knowledgeable about vaccine production. There was a whole acquisition that was done of a company called PowderJet to meet shortages in flu vaccine production for just the North American market. And that involved very elaborate deal vetting before that went down about, well, Chiron was still in business, sort of roughly 2005, 2006.
Yeah.
There are experts in the Bay Area.
No, absolutely there are experts. I'm not saying that there aren't. I'm saying, but you need one of those experts.
Right. I was just saying that there might be a way to network to someone to speak to that issue, to this group that is within the social networks of the people here.
And Mike had just said teleoperated for that. Yeah, they're looking at automating more of this. It's difficult, and people have been talking about automating a lot of these processes for a long time, and it's tricky. And we're getting much better at automating things than we were, I don't know, 5 years ago, 3 years ago even. But nobody's actually gotten to the point. The more critical automation piece that I'm aware of people looking at right now is testing, because it's also really high throughput. In some ways, vaccines are easier because you can do very, very large batches. You can just incubate, 10,000 eggs. You need to get the right kind, and it's complicated, but with testing, there's a lot more kind of room to need that. Anyway.
I have a kind of like somewhat of a curveball, but have you heard of the Health Impact Fund?
No.
It was like an idea that was originally proposed by Thomas Pogge. I mean, I just remember it from back from university. I think they set up a nonprofit around it now, and Amasha Sen is on the board. I think Noam Chomsky. I think Arrow was on the board. I think for a while, or was participating in it. So yeah, I think it has kind of like high support. But okay, maybe I'm butchering the idea, but I thought it was mainly to bring medicine that otherwise wouldn't be incentivized to be produced to poor countries, in the sense that part of you can basically pre-register your medication with that fund, and it would basically pay you out on qualities, I guess, calculating qualities, like number and quality of life, quality adjusted life years saved from folks. So to kind of like decouple that R&D incentive, somewhat at least from kind of like from the benefit. And I was wondering, it's not really so much that it also funded the ones that weren't successful. So it's like a little less ambitious than that. But that those may be people that would be interesting to talk to because they may be sympathetic to an idea like that. And I would be surprised if they haven't done more thinking around this now with COVID-19.
Yeah, I mean, part of my pitch is this is the type of program that my understanding is that a congressperson could stick a line in a bill authorizing HHS to do this. It's not a very complex program. It's a really expensive one. And when I say really expensive, I mean like a tiny, tiny, tiny fraction of the money that they're currently throwing at this. So if they wanted to throw $10 billion at this and just do this, they could fund building these factories. And, the next, that's, I don't know, some fraction of a percentage of what they're going to throw into the next stimulus bill. So I think that this is a good pitch, not just because I think that it's a good idea, but also because I think it's easy for it to happen politically, or I hope.
All right, we have another question from Creon, I think. And then I think maybe we are already out of time. And then I would love to close with some action items in terms of like what bits and pieces do you think should be moved, to make that more likely? But Creon first.
Oh, okay. Yeah. So there's that lab in Wuhan, which is quite sophisticated, the most sophisticated in China, which presumably means one of the most sophisticated in the world. And they've been studying these bat viruses, these bat coronaviruses for over 10 years because they knew there was a pandemic waiting to happen when there was some crossover. And presumably they've been working on a vaccine or at least laying the groundwork for many years, and they're state sponsored. So there's no market failure in the classic sense, and there's no vaccine from them.
Yeah, the lab in Wuhan does a lot of things. They have been worried about a pandemic for a while. People have been talking about the fact that a respiratory pandemic is like pretty likely. Center for Health Security has a report from a year or two ago saying, here are the things we should worry about. And like on the top of the like front page, they're like, oh, and here's respiratory pandemic from virus. Like this is the thing we should focus on. So everybody's known that. The problem is that we didn't know the vector. We didn't know the type of disease. Bats have lots of things that they host. They have lots of different viruses that could have transferred over. And there are a lot of other hosts that the lab in Wuhan and everywhere else has been focusing on. So yes, they've been looking at this. My understanding is that there are maybe a half dozen people in one lab in Wuhan that have spent the past 5 or 10 years kind of mostly focused on coronaviruses. That's a really small amount of money and research to kind of go all out. And they certainly weren't trying to make a vaccine for one specific type of thing, because coronavirus is not a specific virus, it's a class of viruses. They've been looking at coronaviruses for a while. They haven't known which one would emerge. And so yeah, they haven't been working on vaccines. I'd be thrilled if there was government funding for, I don't think there are any non-government biosecurity level 4 labs in the world. So yeah, all of the research that happens in the kind of super sophisticated labs like that are by definition government run. There are lots of BSL-3 labs, which are the ones that can do things with coronavirus now. But there hasn't been a huge amount put into this. Certainly not relative to how much could be done. And yeah, lots of different research priorities need lots of money. And it wasn't clear that this is the one that we desperately would need.
Okay, thank you.
All right, thanks. Okay, so maybe in the last 3 minutes or so, do you have like, with this idea in place, do you have any specific like action items, any specific folks that you think we should be talking to? How do you think this could actually come from an idea to fruition?
So I need a couple of senators on whichever committee drafts the next stimulus bill to decide that this is a good idea. And I say that only a little bit jokingly, because honestly, if the right staffer decides that they think this is interesting, then that's all that it takes. But I think that the next steps for this are really writing up more clearly what it is that's required to incentivize this, and what the and what the mechanism would look like, which is a legal and policy question, and kind of a push to look at what it is that it would look like, and somebody had asked about the pricing. Options pricing is really complicated if you're interested in looking at the price based on the value that it should have. What is being discussed here is actually much simpler because it's a physical option and the only payout that occurs is at the end when the company decides that it does want it, in which case nothing is paid, or doesn't want it, in which case the government pays cost plus some percentage. So this is actually much simpler than most options pricing. Yeah.
Okay, sweet. I think in the chat it was just shared the types of kind of like an example of a publication that gets governments to act. So maybe it's a nice that's a nice template to go after. All right. Well, if you have something written up and either you need another channel for distribution, happy to publish on the website. If you need a publisher, or if you want to do another salon on it, or send it our way so that we can at least share it with the community. That would be great. If we can help in any other way, or folks that are in our extended community, then let me know. And yeah, for now, I thank you very much. I'm hoping that you'll send me maybe a few links in terms of if people want to, for example, get in contact with you, because I will add them all to the Sanity schedule. And that's usually where I add slides or where I add like websites and something that people kind of.
If anybody wants to email me, my full name, no punctuation @gmail.com, or my name on Twitter. Happy to chat with people. I'm fairly easy to find.
Super. Yeah. Yes. As I found out. All right. Hey, thank you so much. Thanks everyone for joining. I see some of you tomorrow. I think it's tomorrow is at 6 p.m. on institutions and their role in let's say global disasters. In once their exacerbation, but then also in cleanup. So that will be done by Samo Burcha, and yeah, then we have another full week of salons, and I think Anthony with Metaculus is on Tuesday. So I think I shared how to join those before. I'm going to share it once more. There's a few links that are kind of relevant to keep track if you're interested in them. One is the Zoom link that's standing. Then there's past and future salons. That's where I update them on our website. Then the videos, they're uploaded once a week onto that website. And then our mailing list is when you want to stay in contact in all of our upcoming events. David, I can't thank you enough. I would love to have you on again. And I hope you all have a lovely Saturday morning or afternoon. Thank you so much.
Yeah. Hopefully talk about something less urgent and depressing.
Hopefully.
Yes. Okay.
Bye-bye, everyone.
Bye.